Good morning, World Tour. Look, I am so thrilled to be in what I believe is the most exciting place to be right now in the public sector today, and the Data and AI World Tour. So just give your hands a round of applause. And I also have the honor to represent what I think is the hottest federal agency in all the federal government, the CMS. Look, today I want to share about how CMS is building an AI native future. We're going to democratize AI, and that with the goal of delivering better care, strengthening the trust, and safeguarding our resources, our taxpayer dollars that we all chip in on. But CMS is not just modernizing IT. We are impacting lives each and every day. And I'm excited to be here today to talk about where CMS is heading with our IT initiatives and how you all are essential partners in our journey. We have a very special relationship with Databricks that helps us harness the power of our data in ways that matter, including helping our beneficiaries and crushing fraud. So let me ask you to picture this. You're in a small rural clinic. A waiting room is full. A doctor is doing the very best with limited resources. A patient badly needs a referral to a specialist. That doctor reaches for the provider directory. It's a thick binder that hasn't been updated in months, years, or even decades. They flip through the pages, find a number, they dial it, but here's the problem. The number doesn't belong to a real provider. It's fraudulent. Someone inserted a fake number, fake listing along the way, hoping to bill Medicare for services never provided. The doctor doesn't know that yet. The patient is waiting and care is delayed. All while fraudsters are waiting for a payday. Now imagine this. Imagine that same clinic, but the tools we're building in CMS. Instead of old dusty binder, the doctor pulls up a unified digital directory. Every provider is instantly accurate, instantly verified, and secure. Fraudulent entries are flagged before they even get into our system. The right specialist is identified in seconds. The patient gets the appointment for that day. Care is faster. Trust between the patient and the provider is stronger, and CMS grows stronger all together. That difference between that binder, dusty old binder, and that shiny digital directory, it may feel small, but in reality, it's the difference between delay and timely care, the difference between fraud slipping through the cracks and fraud being stopped at the door, between a system that frustrates and a system that protects. This is what we mean about digital transformation at CMS. It's not just about IT projects. It's real people, real clinics, and real moments. Moments that matter. With people who feel the impact of whether we modernize or not. It's also about protecting our taxpayer dollars from those, and we have a lot of them, who want to exploit it. This is the kind of transformation CMS is driving for each and every day. So we are not one of those 20-year government agencies. Now, this was only one clinic in my example. one patient, and one doctor. But we operate at a staggering scale. Check this out. CMS, we manage over $1.7 trillion in health spending each and every year. Larger than Apple and AWS, if we have anybody from Apple and AWS in here, by revenue. We serve over 160 million Americans. That is 1 out of every American in our country. We rely on a workforce of just 5,000 and partner with tens and thousands of contractors. And each and every week, we defend against billions and billions cyber attacks against our systems. From adversaries, bad actors who would love to get their hands on our sensitive data. CMS, we not just a pair of claims. We are a national engine of healthcare. We set insurance rules. We establish quality standards. We make payments to providers, safeguard sensitive health information, and protect taxpayers' dollars. We balance the need for speed with responsibility to protect, because every claim, every login, and every data transfer carries enormous weight. This makes us one of the most consequential agencies in all the federal government. And with this scale, standing still is just not an option for us. CMS faces a critical challenge. We must crush fraud, we must secure our data, and we must deliver faster, all by relying and providing more reliable care. That is a daunting task. So to meet these demands, I want to talk to you about some ways that CMS is looking to transform. And that's exactly what we're aiming to do in 26, calendar year 26, all while being anchored in an AI native operating model. Our 2026 strategy focuses on 9 key IT priorities, and you see them listed here. But these are not just technology projects that I mentioned earlier. They are our foundation for transforming healthcare nationwide. Each priority accelerates operational excellence, protects public trust, and modernizes how we do our programs. We're taking and talking about advanced cyber defenses, smarter claims processing, a unified provider directory, and a workforce modernization to help do it all. Let me dive deeper in just a few of what I find as our game-changing priorities. Here you will see 4 that's going to reinforce another to deliver faster, safer, smarter healthcare for over those 160 Americans I talked about earlier. Each reflects not just what we're building, but why it matters to the people we serve. First, we are embedding AI across CMS to prevent fraud. We want to detect anomalies, and we want to support smarter claim decision-making. CMS, as I mentioned, is a prime target. Billions of cyber attacks hit us each week. Cyber defense is not a project for us. It's a living discipline. Protecting CMS's sensitive data is my top priority. And this is why recently I issued a memo that requires all the contractors that do business with us to complete vetting prior to accessing our systems. No work that requires access to our systems can begin until everyone is cleared. But that's exactly why we built security into everything we do. Our approach includes zero trust architecture, advanced monitoring, automated responses that adapt to new threats. We expect those to kind of be built in the tools and platforms that we invest in. Now let me touch on fraud prevention, because that is very equally important in protecting the taxpayer dollars that I've been mentioning and preserving the trust in our system. Fraudulent claims waste resources. We all know that. It delays care and erodes the confidence in Medicare and Medicaid. So how do we tackle this challenge? Our approach combines 3 key AI cybersecurity tools. 1, AI-driven anomaly detection to flag suspicious activities and for our claims instantly. Data matching algorithms that prevent duplicate billing to uncover fraud, such as the $106 million in improper payments that CMS and VA found together earlier this year. And 3, automatic triage to route cases to investigators quickly. We don't have time to wait once those things are flagged. Every fraudulent dollar stopped becomes a dollar invested in care and trust earned in our citizens. That is why we have partnered with Databricks to identify improper payments through predictive models by comparing peer groups. This cyber defense is foundation and essential because it protects the integrity of our claims and our programs, which brings me to a second priority. We are modernizing our claims processing platforms so providers and beneficiaries can get faster and more accurate service. CMS processes over $1 trillion in claims each year, as I mentioned earlier. Yet, legacy platforms are limiting our ability to adapt and slow up service. Our modernization approach is modular, resilient, and cloud-enabled. So with an AI mindset throughout, we're applying AI in 4 key ways. 1, smart routing that gets claims to the right system faster. Predictive analytics that catches errors before payments even go out. Chatbots and virtual assistants that handle routine tasks, freeing our staff for the more critical mission work. And this results in faster, more accurate payments to providers, which is very important to our providers. Better experiences to our beneficiaries. We want to bring the best experiences possible, and the stronger stewards of the taxpayer funds that we oversee. But to accomplish all this, we must migrate off mainframe and modernize. And to achieve this transformation, we need the right infrastructure and the right talent foundation in place. Let me talk a little bit about that. So we're building cloud platforms, shared services across the silos of our organizations, and a skilled in-house workforce in AI, cloud, cybersecurity to sustain these capabilities. None of these transformations succeed without the infrastructure and the people that power them. CMS is embracing a multi-cloud environment for resilience, scalability, and flexibility. We are building enterprise shared services and platforms. We're no longer going to have several different platforms that's doing the same thing in our ecosystem. We need to reduce the duplication, accelerate delivery, and improve security by doing that. Most important is our workforce. No matter what technology we bring in-house, it doesn't alone transform government. Our people do. So we are investing in training and upskilling in AI engineering, cyber defense, cloud security, and full stack development, and data science. This ensures the teams can design, manage, and sustain the platforms that we invest in. The outcomes that we hope to see is faster time to market to our tools. We can't wait. More consistent services across CMS, and a workforce that is prepared for these technology shifts that you've been seeing this morning. This infrastructure and the workforce foundation enables my 4th and last priority that I want to share with you today. I have 9. And that's making sure that data flows seamlessly where it's needed the most. This brings us full circle to that rural clinic that I described in the beginning of this discussion. Enabling secure data interoperability and creating a unified national provider directory so that providers never have to rely on an outdated binder again. I believe that data interoperability is not a technical luxury for us. It's a healthcare necessity. Our patients, our providers, our payers, all depend on accurate, secure, timely data. One of our flagship initiatives that I talked about earlier is the National Provider Directory. What we aim to do with this initiative is create a unified digital directory that eliminates errors and referrals, reduce fraudulent billing by validating provider identity, and improving patient experience so ensuring care is not delayed due to inaccurate data. An AI native approach, one that we're taking, makes interoperability stronger in 3 key ways. 1, it validates provider data in real time, so the information stays accurate. 2, it maps different data sets into reliable source, so everything connects. And 3, it spots gaps and inconsistencies early, before they are a big issue and affect our care. The results: fewer errors, faster referrals, and a stronger trust between patients and providers and the payer. Together, these priorities, cyber defense, modernizing claim, scalable cloud, and interoperability, form a foundation for an AI-native CMS, delivering faster, safer, and smarter healthcare. So at CMS, this impact for transformation is real. The things I'm talking to you today, we are doing now. First, the adoption of AI tools is strong. At CMS, as of this morning when I checked my dashboard, 83% of our workforce is using AI every day. That means our employees are saving on an average of 6 hours a week. That's time that I can spend on high-value work. Second, our fraud analytics is already paying dividends. We flagged, as I mentioned earlier, already 106 million in improper payments between VA and CMS. That's money recouped. That's money redirected back into patient care. And third, our shift to the cloud is enabling resilience and innovation across CMS. It's not just about the technology, but it's about creating the flexibility foundation that lets us deliver services faster, scale when needed, to keep our systems secure. For a specific example, we use Databricks Assistant to migrate legacy SaaS code and convert that over. This allowed us to modernize our systems and deliver better healthcare. This example shows that we cannot do it alone. We need strong industry partners like you. So as members of the data and AI community, I want to leave you with a few questions. 1, are we building AI that solves yesterday's pain points, or AI that reshapes how government delivers value for the next decade? I hope it's the latter. Let me know. 2, what would our agencies look like if every mission, decision, every policy, and every operational workflow were powered by real-time, trustworthy data? Why isn't that our reality today? And the third question I have for you: if the public trusts us with their most sensitive data, what must we do to earn that trust in how we use AI? As we look ahead to these priorities, it will take all of us, government, industry, working in partnership. We need mission-specific innovations that drive outcomes, not flashy promises of new products and tools. Together, we have the power to transform healthcare. No doubt about that. By uniting our talented people with cutting-edge tools, we'll deliver exceptional care at every citizen, including you and me and our loved ones, expect and truly deserves. This is our mission, and together, we will make it a priority. Thank you, everyone.